Hey people, how are you? Thank you for joining me. Hawanda is here and it is time to take care of our teeth. Yeah. So today the topic right now is going to be cavities. We cannot exhaust this topic. Cavities are the most common question or disease that we find in the clinic, and hopefully we are going to be able to just do an introduction on it, and then of course with time we'll get to know much more or better about cavities, how to prevent them, how to manage, and things like that, right? So I've come with my model here, my model. These are teeth, right? And let me just try so normally the teeth should be kept clean and free of any food particles on the teeth. Naturally saliva does that for us, but in addition we also brush our teeth. So how does a cavity start? So when there's any food remnants left on the teeth, there's what we call plaque formation. So when the food is left there, there's plaque, and then bacteria comes and starts acting on that food that is there on the teeth, right? So a byproduct of the bacteria or a waste product is acid. So what happens is that the acid affects the enamel or the tooth substance and wears it out, and with time it becomes a cavity, it becomes a big hole and a bigger hole and a bigger hole. So there are different stages of a cavity. So let's say this area, this is the enamel, the outer covering of the teeth. When a cavity is just on the enamel area, when you look at your teeth, you'll just see a white spot. That is demineralization. That's the first stage of a cavity. So if you change your routines and you clean better or properly, then that one will not progress beyond that. It will either turn brown or black, or there'll be a dent there. But if it's on the enamel, the discomfort or the sensitivity will not be much. But once it crosses over into the second layer of the teeth, which is the dentin, then you start getting a hole, a big hole, and sensitivity. Anytime you take something cold, something hot, something sugary, you feel tooth sensitivity. And normally people just brush it off. They say, nowadays my teeth are sensitive, and they brush it off, or they buy sensitivity products. The best thing would be for you to go see the dentist, because at that point it is easy for that to be repaired by doing a filling. A filling is where the decayed part is removed and an artificial covering is put there. It's like artificial enamel. And then now that way you have stopped the process of getting the cavity, and then there's no more discomfort or sensitivity or pain. But if you choose not to see the dentist immediately, then the cavity continues going deeper and deeper into the tooth, and it ends up in the middle of the tooth, which is the pulp. The pulp is the center of the tooth where all the blood vessels and nerves are. And once bacteria finds its way there, it multiplies very fast and forms pus as a byproduct. And now that is when you have a toothache. And that's when someone comes and tells you they feel like there's a heartbeat there, like there's a pulse, it's pulsating properly. So what happens is that the tooth is a very small space, and as you can see, when there's an infection and there's pus accumulating in the tooth will not expand. So it will be like a bottle, it will be like bottled pressure, or an infection is causing fluid to accumulate, and since the tooth is not expanding, that's when you feel the pressure. With time, at that time you need to see the dentist. You'll have to be given medication to work on the infection, and then now depending on the situation, the dentist will advise you accordingly. And at this point it is either a root canal treatment or the tooth will be removed. At this point, when there is pain, a filling will not do it for you. Yeah, if you just come and do a filling there, now you have closed in an infection, like you have not dealt with the infection, and the discomfort you will get is just not interesting. So after some time, the past is pushed to the surrounding structures. And that's when you find that your gums are swelling, or you have a swelling next to the gum, right? That is what we call an infection or an abscess around the teeth. So when you see the dentist, the abscess may need to be drained, and then access of the tooth to remove all the infected materials, blood vessels and nerves, and cleaned, and the tooth is cleaned thoroughly on the inside. That is what we call root canal treatment. Depending on the severity of the infection, you may need to go for 2 appointments or 3 appointments for the same tooth. And once the cleaning is done and the filling or root canal treatment, then the tooth becomes totally asymptomatic, and you keep it for life. Of course, you'll end up needing a crown later. But that is basically those are the basics. That is the best way I can describe cavities and pain. So it's, as I told you, either have root canal treatment done or the tooth is extracted. Otherwise, if you leave cavities, they tend to spread because it's a bacterial infection. So the moment you notice that one tooth has a problem, please get it fixed. Otherwise, it will keep spreading and spreading and spreading. And then you'll wonder why you are the one with the dental problems. It's because you're leaving them to stay there. It's like, let's say you have a sack of potatoes. If there's one bad potato, it spreads to the other teeth. Or if you have tomatoes and there's one bad tomatoes, there's a way it spreads around. So of course the mouth is a closed area. If you have one bad tooth, it will spread to the rest of the teeth. So the best way to prevent spreading or getting worse is, if you notice anything strange on your teeth, go get checked by your dentist. Of course, importantly will be to do your annual dental checks, where the dentist will be able to notice these cavities that are starting when they are still the small white spots, before they become big cavities and they cause you discomfort and pain, and management becomes expensive. It's expensive to treat. You have to miss going to work, or maybe it will be inconvenient for your colleagues because you're not going to work and you have to go to the dentist, or maybe if it's school you're missing classes. So the best way would be to prevent dental cavities. Yeah, so I think that's what I can say. If I've left out something, please remind me in the comments. Please let me know what you think, and please remember that this channel is not a substitute for your dentist. You have to see your dentist, get a proper diagnosis and a proper treatment plan. And remember, you know, sometimes we feel wise when the pain is managed and now you're able to eat and you're comfortable and you're told you need to come for a second appointment, but you're like, but I'm not in pain, and you don't show up. Please show up for all your appointments and take care of your teeth, because if you take care of these teeth, they'll take care of you in old age. Sawa sawa? Yeah, and of course the most important thing is to brush and floss every day. As long as you keep your teeth clean, you'll end up minimizing a lot of the problems you see. Sawa sawa? Take care. This is Hawandes, and I am very happy about your support, and I hope to reach more people so that at least we can learn how to take care of our own teeth. Sawa? Brush and floss every day. 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 Brush and floss.